The menopause is actually one day in your life, interestingly.
Hi there, and welcome to Am I Crazy Or? The podcast where I, Lisa Påske, take on all the ways that society is trying to gaslight us into thinking we are going crazy. This season, we are tackling the perimenopause. They often call it the second spring. I think it's more like the monsoon season. But I'm not doing this on my own. Each episode, I'll be interviewing a variety of experts as well as women going through it. This week, I had the pleasure of interviewing a Dr. Myra Mahadevan. She's a menopause specialist doctor and GP from London, and she has been working for over 25 years helping thousands of women, including myself. You'll hear that story today, as well as our discussions around blood tests, UTI, depression, what's the other one? Memory loss. By the end of this, you will have a much better idea and hopefully some reassurance that you are not going crazy. Hello, Mayura.
Hi, Lisa.
Hi. I'm so excited to have you here.
Yeah, it's lovely to be here. It's nice to see you again.
Oh, it's lovely to see you too. So you were my menopause doctor.
Yes.
Yes. So I'm quite excited to have you as a guest on Am I Crazy Or? So can you tell me a little bit about yourself and what you do first?
Sure. Yeah. So as you know, I'm a menopause specialist doctor and I work for Menopause Care, which is a menopause clinic that was set up by Dr. Naomi Potter. And there is a group of I've lost count, but there were quite a few of us accredited menopause specialists, and we cover various face-to-face clinics across London and the rest of the UK, but also online as well. So that's what I do some of the time, and I'm a GP in Wimbledon.
How did you get into this? So you've been a GP for how long?
Too long.
Sorry.
So I've been in my practice for 20 years in Wimbledon, and obviously I trained as a GP before that. So yes, I've been doing that role for a long time, and I've always had a really big interest in women's health. And I think when I entered my 40s, I started to realise that there was this big area of medicine that I hadn't investigated very thoroughly. At medical school, we had very little education about the menopause. I think we possibly only had a half hour or 1 hour lecture actually.
What?
In the whole of our medical training. I mean, this was quite a few years ago, and I'm sure things have changed a little.
Wow, that is mind-boggling, isn't it?
It really is. It really is. So then obviously I was a qualified GP and working in general practice for a number of years, and realised that this was an area I needed to understand a bit more about. So I undertook some further training and attended lots of courses and became a member of the British Menopause Society and became an accredited British Menopause Society specialist.
Oh, and is that like a requirement to work specifically on menopause?
It isn't a requirement, actually. Okay. So there are huge numbers of menopause specialist doctors who are not accredited, and it doesn't mean they're not doing a good job, because of course they are. I think the important thing that as a doctor we need to focus on is practicing safely, practicing evidence-based medicine that is in line with current guidelines and what is considered good practice.
Yeah, we can talk a little bit about how my journey was as well, because I came to you in quite a state of like despair, I would say. But before we go into that, let me just ask you about the definition of what perimenopause is and what menopause is.
Yeah, so this is important to understand, I think. The menopause is actually one day in your life, interestingly. So the menopause is basically when you have had no period for 12 months. So on that day, 12 months after your last period, you are in the menopause. Every day after that is basically postmenopause. So from there to the end of your life, you're postmenopausal. And before that, you're probably perimenopausal for anything up to 10 years. Wow. So it's really interesting, because if we look at, on average, I would say a woman would become menopausal between the ages of, say, 45 and 55. I think the vast majority of women will fall into that category. And so if you are looking at a woman who has a menopause at the age of 45, if you think about her perimenopause, which could last 7 to 10 years before that, she could potentially be experiencing perimenopausal symptoms in her mid to late 30s.
Wow. And I really don't think most people know that.
No.
And that, I think, was the big shock for me, because I think most women, we just think that menopause is something that happens sometimes in your 50s.
Yes.
And technically, that's correct. But the perimenopause is usually where you have the most symptoms, or is that right?
Very often that is the case. So hormonal fluctuations start occurring in the perimenopause. And as I said, this can be 10 years before periods stop. So you've got a decade, perhaps, of chaotic hormonal production, which is generally declining, but, has peaks and troughs. This is why the symptoms are so varied and each woman's experience can be so different.
Yeah. And is there any symptoms that are more common to start with, or is there something that we can be looking out for that might be a sign that perimenopause, like you're going into perimenopause?
I wish I could say yes, but the answer is probably no. Everyone is different. We've got the classic, textbook symptoms that everyone seems to know about, the hot flushes, the night sweats, changes in menstrual pattern. But the list of actual symptoms probably is close to 100.
Wow.
Because what we're talking about is dropping levels of estrogen. And if you think about your body as a whole, every system in your body has got estrogen receptors. And it's when those estrogen receptors haven't quite got enough estrogen, that's when we start to experience symptoms. So dry skin, itchy skin, eyes, dry eyes, visual changes, dry mouth, burning mouth. A burning mouth is a fairly typical symptom of the menopause that women come to me about. And interestingly, a few dentists are now referring patients to me because patients have come in to see their dentist because of burning mouth.
And what is burning mouth? Is it like...
So it's just a feeling of burning, a burning sensation in the mouth, interestingly.
Wow.
So, yes, so those are some of the symptoms. We've palpitations, vertigo, tinnitus, bloating, joint pains, a musculoskeletal syndrome of the menopause is something that's being discussed quite a bit now. And, we see lots of women presenting with frozen shoulder, pain in the feet, hip joint pain, knee pain. And these are all related to declining estrogen levels, probably, because if you think about it, estrogen has some anti-inflammatory effects. So when we've got lots of estrogen circulating when we're a bit younger, we don't have the aches and pains that we experience as we get older. Of course, there's a bit more wear and tear, but it's largely due to a reduction in the circulating estrogen.
Oh, that's so interesting. So there were a few things there that I really want to touch on, because so I think I first saw you nearly exactly a year ago.
I think so, yes.
Yeah. And in that period leading up to that, I would say the 3 years leading up to that, and what I now realize might have been my first symptoms was I had a lot of joint pain, and I had a shoulder that I couldn't move any further than up to here.
Yeah.
And I actually had a keyhole surgery on my shoulder because they couldn't figure out why it was. Mm-hmm. No one ever mentioned to me that menopause could be a trigger of this.
Yeah, it's such a shame because so many women like yourself come to see me and they've already been to see maybe 3 or 4 different specialists. They've seen, a rheumatologist or an orthopedic surgeon. They might have seen a cardiologist because they've had palpitations, or an ENT specialist because of the dizziness and vertigo. And actually, if you look for a common denominator here, it's hormone.
That is so interesting. And also, like, that was just one of them. So the frozen shoulder came first. That was probably, I think the year that turned 40. And then I had the operation when I was like 41. And then I had the most excruciating pain in my left hip and one of my knees. So I had x-rays and MRIs, and they couldn't really find anything. They said like a little bit of tear and stuff. So you might get arthritis when you get older. And this is the thing that really is shocking, then they recommended that I don't do any other exercise than cycling and swimming. Now I know how important exercise is for your body when you are in menopause, especially muscles. That was terrible advice.
Yes.
But also, I completely ignored them. And I got really scared that I was declining really quickly, and I was just 40. I was 41. So I started actually double down on the exercise and got a PT and started doing a lot of weights, but without any knowledge. So it was kind of like luck of my instinct that was like, nah, I don't want to do that. But so do you get a lot of people in clinic that have been through a lot of tests and stuff beforehand?
Absolutely. And one of the other things is, of course, mental health symptoms.
Oh my God.
So many women present with low mood or anxiety or flare-up of symptoms. And I think it's important as clinicians, I think if we see a woman of 40 plus with a new first onset depression or anxiety, we really must think broadly about this person as a whole person, as opposed to immediately with a knee-jerk reaction saying, here, have some antidepressants. We really need to be exploring further whether this is hormonal, because
Yes.
it probably is.
Oh my goodness. I'm so glad you said that, because that was the thing that really, that is the reason why I came to you in the end. I was desperate. Not only was my moods low and I experienced more PMS and such, I really didn't feel like myself. I felt so down. I would have the majority of each month in such a, like, I used to call it PMS depression, because
Yes.
I always used to have that week before my period where I felt really low. But that extended now to 2 weeks and sometimes longer, where I would feel so low I could barely get out of bed. And I just didn't know where to turn. And then the other thing that really affected me, and I remember what I said to you when I first saw you, I could not remember anything. Like, my brain had just turned to mush, and like I couldn't even remember things like 5 minutes, what's happened 5 minutes before, the short-term memory particular. And I had been a woman that had built an agency, built a business and sold it. And I was really capable and, actual engaged and intelligent, I thought. And I literally thought I felt like I would never be able to work again. And I remember coming to you saying, maybe I have early onset Alzheimer.
Yes, I remember that. I do remember that. And you'll be surprised. It's a thought that occurs to so many women in the perimenopause, and so many women. So if you think about the age at which the perimenopause hits, it's very often in women who are fairly senior in their roles. They've been a big part of the workforce for a number of years. They've got lots of experience. They should be valued people within their organisations. And these women are getting to the point where they're actually thinking about stopping working because their brains are not functioning as they should. And it's such a shame. And we need to really address that, because, it's very straightforward and simple to sort this out. And, interestingly, just to go back to your point about the PMS symptoms you were experiencing in the week leading up to the period, and then the 2 weeks leading up to the period. And that's really typical, again, because what we're looking at there is just to go to kind of clinical terms, you're looking at the luteal phase of the menstrual cycle. So this is the 10 days or 2 weeks leading up to the onset of the period. And in that phase, we have estrogen levels which are declining naturally, and progesterone levels which are increasing. And in the perimenopause, it seems that those declining estrogen levels combined with the underlying fluctuations are what result in this worsening of PMS type symptoms. So very often an early perimenopausal woman will come to me saying, do you know what, I feel absolutely shocking in that week or two before my period, but the rest of the time I'm completely fine. And this is a clear sign of the start of hormonal fluctuations.
Oh, that I so wish I knew that. And because I've always had PMS. And I think as women, we kind of like, I think PMS is quite a weird thing, because anything that makes you suddenly feel angry or sad, or we kind of internalize it as something that to do with us
it's
as
our
people.
Fault. Yes,
that it's our fault.
Yeah.
You know, and so it makes it quite hard to talk about as well, I think.
Yeah,
it does seem like a huge proportion of women in their 40s that are given antidepressants, SSRIs, would do better to try HRT first.
Possibly, yes. I think what we need to keep in mind is if there's likely to be an underlying hormonal disturbance, which there is in the perimenopause, we should be looking at that first. That's not to say there isn't a place for the use of SSRIs, because sometimes, it needs to be done in combination. But we should be addressing the hormonal issue first
to see how you feel.
Yeah.
After I had like the shoulder operation and everything, I had just sold my business, so I was like, it was quite hectic and it was quite stressful. So again, I thought it was because of that. But my GP was keen for me to start back on the antidepressants. So I had, and this is telling, I had postnatal depression. I had postnatal depression and was on antidepressants for quite a while afterwards. Now, do you think that a woman that has had postnatal depression is more likely to get a worsening of mood also through perimenopause?
Yes, absolutely. So we often see that there seems to be a link with postnatal depression, PMS, and mood symptoms associated with the perimenopause. So that's one of my questions. So I don't know if you remember when we first met and we went through your history in quite a lot of detail in that first appointment. That's one of the things I always ask about is, did you have any kind of mood disturbance having your babies or hormonal issues? So, there's a thing called hormonal depression, which, a lot of women have experienced throughout their lives from their teens onwards. And it's very often, if we're looking at this, it's very often those women who then experience the more dramatic mood changes in the perimenopause and menopause. Yeah,
I definitely think I'm one of those. In teenage years, I really struggled with regulating my emotions. And anger, and would I had the nickname the last Amazon because I was like always kind of like fighting about something. But it was really awful feeling, isn't it? Like when you feel like not in control, because it has such an impact on the rest of your body, how you feel in general. And then there's a lot of shame about feeling like we're angry. Anger in women is quite
it's not acceptable, is
it? No. And if you are angry, then you're kind of hysterical.
Yes.
And which is also, interestingly, the word hysterical actually meaning uterus.
It's to do with the womb. So absolutely. The operation for the removal of a woman's womb is a hysterectomy.
Oh my God.
And it's very similar to the word hysteria.
Yeah, that's so interesting that we are literally just making this like a bad thing.
Yes.
I looked through my medical notes. So after I saw you last year, I became quite slightly obsessive about trying to figure out when he started. So I was looking through my notes and I could see like around the age of 38, I went to the doctor at least twice a year after that, complaining about feeling really tired and fatigued.
Yes.
And I did so many blood tests. They kept on doing like full bloods, vitamin B12, vitamin D. And I kept on taking vitamins and doing everything they told me, and it made no difference. So fatigue, it seems to be like a big one to start with.
Definitely.
When you say changes to your menstrual cycle, what could that be? Does that mean, because I thought it meant that your period will get less.
It can mean almost anything, to be perfectly honest with you. So, I think that the common thought would be, periods get less or lighter or less frequent, which ultimately they will do. But in the perimenopause, it can be more frequent periods, it can be heavier periods, more painful periods. It can be lighter, less frequent, but there's no rule here. Yeah. It can be very variable.
But a change, the main thing you're looking out for, a change for you, basically.
Yes, absolutely.
Because I think my change was around age 40. Again, I saw in my medical notes, I had very heavy periods and like I started getting clots.
Yes.
And so for a period of about 6 months, I had to change towels like every hour.
Yes.
Like minimum. And sometimes it would just feel like it was gushing out.
Yes.
And I had never had that before, and I got really scared.
Yes.
I was like, whoa, these are like, they look like they were bigger than 50p coins.
Yeah. So this is what we call Menorrhagia. So menopause, Menorrhagia, basically, where you're bleeding very heavily. And, if that carries on, it really should be investigated, because it could be due to an underlying gynecological issue like fibroids or an endometrial polyp, for example. But ultimately, it's usually a hormonal disturbance that has brought this on. And of course, if you're bleeding very heavily, you can become iron deficient, you can be very, very tired. So that adds to the exhaustion. Yeah. And then, of course, if you've got hot flushes or recurrent urinary tract infections and so on, you might be up at night as well. So you've got a combination of things going on.
The sleeping, the insomnia. Again, I thought that was my work thing. But that was really big. Like I really struggled sleeping and staying asleep. So I would like wake up, and if I woke up around 3 o'clock, it was nearly impossible to go back to sleep.
Yeah.
And is sleep disturbance?
Sleep disturbance is another very common symptom. Yes.
Yeah.
So it's not just because a woman is sweating at night that she's not sleeping. It could be that she's not sweating at night and not getting up to go to the loo, but she's still not sleeping.
So I had night sweats actually really early on. That was actually before I was 40. Yeah. And again, I went to the doctor complaining about these night sweats. And I think that was the only time they did some kind of like blood test on hormones.
Yes.
But it was quite early on, but they disappeared. So I had that for about a year. I had like soaking, like sheets.
Yeah.
But does that indicate like there's no kind of indication that you will have night sweats at a particular time? It isn't like an early symptom.
Some women don't have night sweats at all. Interestingly. Yeah. So, and typical of the perimenopause, it can be transient. So you could have night sweats for a few months and then that could settle completely. But then you might be presented with another set of troublesome symptoms.
Yeah. So one symptom that I think is quite interesting and I feel is almost talked about too much is every doctor I saw when I was kind of like wanting to know more about this, they and I think nearly every friend I have that I've talked to about menopause, when they went to the doctor, the first thing the doctor asked was, are you experiencing hot flashes?
Yeah.
Why is that the main thing?
Well, I think in my 1 hour lecture at medical school,
that's why.
That's what was mentioned. Oh. That was, that's a typical menopausal symptom, which everyone will probably, people who know about something about the menopause will say, hot flushes.
Yeah.
So, and it do, hot flushes do affect quite a large proportion of perimenopausal and menopausal women. But it's not the only symptom, of course.
Yeah, I haven't had any so far, thank God.
Yeah.
Well, touch good, because that might just come tomorrow now. but that's one of the, I think the danger with talking about one specific symptom, and especially with that one, is that I feel a lot of doctors are using, are you experiencing hot flashes as a, if you aren't, you're not in perimenopause,
yes,
or not in menopause?
Absolutely. No, we shouldn't be using it in that way. It should be part of a number of questions to look at other symptoms as well. Because, as we've discussed, the menopause and the hormonal fluctuations affect all systems. So it's a multi-system condition that can present with a huge variety of symptoms. So it's really important to look at all of them.
Are there any symptoms that doesn't get talked about much that you see?
I mean, there are so many symptoms. I think we've spoken about quite a few. The mental health symptoms, I think we should be talking a bit more about. But then in addition to those, there are the genitourinary symptoms.
Oh my God, we haven't talked about this yet.
This is a big one,
oh my
of
God.
course. So estrogen depletion in the genitourinary tract can result in some really quite troublesome symptoms, which for some women can be a little embarrassing to discuss. So perhaps they're not raised, but symptoms such as vaginal dryness, vaginal irritation, pain during intercourse, pain in that area from wearing tight clothing or, exercising, walking, running, that area can become very sore and inflamed because of the lack of estrogen in the area. In addition to that, the urinary tract, the lower part of the urinary tract can be affected, and a lot of women start to experience symptoms such as urinary urgency and frequency. I know my colleagues in the clinic often talk about the key in the door syndrome, where you just about make it to the loo. The urgency is so great.
Yeah.
Then recurrent urinary tract infections, that's a common one, and a huge number of women experience that. And this is a problem, interestingly, that does improve with HRT, but there's more specific treatment for this. So we very often use topical low-dose estrogen preparations in that area, and it makes such a big difference.
I was one of these. This was the one that really shocked me.
Yeah.
Because I had a UTI on and off for over 1 year. And
yes, I remember now.
Yes.
Yeah.
So when I came to you, I didn't even think about mentioning this. And I just mentioned it on a whim.
Yeah.
And I had antibiotics, like a smaller dose antibiotic for 8 months consecutively.
Yeah.
Because the UTI kept on coming back. And before this period, I might have had 2 UTIs in my life, and it would not go away. Yeah. I was on antibiotics, I was on D-Menose.
D-Menose, yes.
D-Menose. Yeah. And I saw a gynecologist, a urologist. The urologist was a woman in her late 40s, possibly. And I saw her 3 times. The last time I saw her, she wanted to do a procedure to widen the urethra. Yeah. Which I really did not want to do.
Yeah.
But at no point whatsoever did the GP, the gynecologist, or the urologist mention anything about hormones or menopause.
Yeah, such a shame.
Oh my God. And the really interesting thing and the great proof of this is that since I saw you and started HRT, you gave me estrogen gel as well as the estrogen. I have not had a single UTI. So there's the proof for that.
Yes, absolutely.
And that's shocking because you don't really think that UTI would be Well, I never thought that would be a connection, but it makes sense now.
Yeah,
because
absolutely.
all the tissue changes with the
Yes.
estrogen depletion.
Yeah.
The topical estrogen, you can take that, like anyone can take that, even...
Well, it's available to purchase over the counter now.
Oh,
so
wow.
Interestingly, but yes, it's very low dose. It's not absorbed to any degree systemically, so it's extremely safe and effective. I mean, actually, if you think about it, urinary tract sepsis is a big cause of female deaths.
Wow.
And if we thought more carefully about it, as women get older, we should be looking to improve the urinary tract health, to minimise those episodes of infection, which can be very, very serious as women get older.
Yeah. A lot of people ask whether there is a blood test to know whether you're in perimenopause.
So the simple answer to that is no. There isn't a definitive test that can be done to say, yes, this is the perimenopause. Now, if a woman stops having periods or they become very infrequent, there is a blood test that can be done to look at the follicle stimulating hormone level. And if that is elevated in 2 readings a few weeks apart, there's a good chance that this is the menopause. But for the vast majority of perimenopausal women, a blood test is useless because the hormone levels are fluctuating so rapidly that you can have a high level on one test, you can have a standard normal level on another test, and a very low level on another test. It doesn't follow any pattern. And therefore, it's actually better not to try and do a blood test. It's actually to go on the symptoms and get I think the importance is getting a really good history to understand whether this is likely to be the perimenopause.
In fact, I had my best friend, so I'm obviously from, well, not obviously with this Irish accent, but I'm from Norway. And my best friend in Norway, she is the exact same age as me, is just 20 days apart. And this year, I kind of thought she might also be in perimenopause for a while. But this year, I encouraged her to go and see her doctor because she also was getting UTIs. And I was like, oh, maybe we're more similar than I thought. And her mood, she was so low, really low, like scary low. And I was like, you please go and see the doctor. And they immediately said, are you experiencing hot flashes? And let's do a blood test.
Right.
And so the blood test came back that it was fine.
Yeah.
But then when she looked back of a few years before she'd taken a blood test for something related to the hormones, it was much lower. Mm-hmm. In a country like Norway, where you think that, oh, they've got it all figured out. No one has it figured out with this.
It's difficult. I mean, I don't have a problem with doing blood tests. Blood tests are important because sometimes we need to exclude other reasons for symptoms. So if a woman comes in, for example, with hot flushes, it would be important to check their thyroid function as well. We can't just presume. But I think normal hormone tests shouldn't be a reason not to give HRT.
Yeah. And I guess the main thing is that for the blood test to say anything, is it correct that it only really makes sense when you're postmenopausal, because then you can see the actual difference, while the main thing in perimenopause is the up and down.
Absolutely. Yeah.
And that goes up and down cycle and daily?
Yeah, probably, hourly probably.
Oh, this makes sense now.
So actually, from my point of view as a doctor, the only really useful time to do a blood test would be in a young woman who is maybe under 40 and we're trying to establish, is this hormonal, is, someone of, say, mid-30s with period changes. It's worthwhile doing a blood test, but we shouldn't be too fixed on the actual result. But in the perimenopause, as I said, there's no reason to do it. In the past the menopause, actually, there's also not much reason to do a blood test to make a diagnosis because the woman is the right age, she's not having periods, so therefore she must be postmenopausal.
Yes.
So
yeah, exactly. Yeah. That's the proof in itself. Yeah. Is there no advice that you can give to women going to see their GP? How can we get better treatment going to the GP, because I had to go to a private menopause clinic to get the help, because they basically told me, no, you're not menopausal.
Yeah. I think it would be really important if someone was approaching their GP to be really honest about the range of symptoms, and also to make it clear that they've done a bit of research and this is what they believe is going on, and to have that open discussion. Vast majority of GPs are very open to discussing these things and will be led by the patient, I'm sure.
So basically just do your research, and also I think maybe for me, I realize now that there were symptoms that I just didn't think were relevant, so I didn't say them.
Yes.
So just if there's something that you feel is not right, something not right, and you don't think it's related to this, say it anyway. And then
absolutely. I mean, there are so many places that you can look at symptom checkers. So there are lists of symptom checkers, and it's quite surprising when you go down them and you think, oh goodness, yes, I've got pretty much all of these symptoms. So it's worthwhile looking at those and maybe keeping a record of what's going on.
Yeah. I still remember the day that I first saw you. I felt so desperate. I felt so down, and I felt like no one really cared that something wasn't right. Like I kept on saying to the GP, I just don't feel right. I feel like, so I was getting anxiety about that there were underlying like cancer or, and that anxiety also didn't help my mental health.
No, that adds to it, doesn't it?
It's so scary.
Absolutely.
And you know when you don't feel right.
Yeah.
And so trusting that instinct. But it was my best friend that had a friend that had actually seen you guys. And so when I came to you, and I kind of blurted out all of these things, and you were like, yes, that all makes sense to me. I remember just crying, going like, oh my God.
Yeah, I know it's sometimes a relief, I know. And as you said, you know, the symptoms can be so varied that no two women are the same.
Yeah.
I mean, one of the things I think we haven't mentioned is the sort of change in cognition, higher mental functioning, focus, memory, word finding.
Yeah.
You know, when you're going, oh, what's the name of that thing?
Yes.
You know, but also libido.
Oh yeah.
Decrease in libido, changes in sexual function, and that can be combined with, you know, if a woman's got vaginal soreness and dryness, of course that's going to contribute to not wanting to have intercourse.
Yeah. I think that's one of the things that's quite embarrassing to talk about. Yeah. But I definitely had that. And again, I thought it's just me. Like I'm not really interested.
Yes. The change in hormones is obviously affecting the hormones that are produced in our ovaries. And testosterone is one of those. So we've talked about estrogen and progesterone, but testosterone is another hormone that's produced in the ovaries. Testosterone is also produced in other parts of the body, and the decline is slightly different compared to the decline in estrogen. But this general decline is what brings about the changes in the perimenopause and menopause. And balancing your estrogen levels can very often correct that. So a lot of women who take straightforward HRT containing estrogen and progesterone, if they've got a womb, will see a definite improvement in libido. There's a small number of women who don't, in which case it's worthwhile considering for low libido using testosterone as part of HRT. And this is sometimes not talked about very much because testosterone is a very important female hormone. It's not just a male hormone. And interestingly, if we're looking at actual serum levels, if we're looking at the numbers when we take blood tests, a woman in her 30s could well have higher testosterone levels than estrogen levels at some parts of the month.
Oh, wow.
The thing about testosterone is, for some women, the decline in testosterone doesn't bring about a lowering of libido, but it can also lead to lower energy levels, difficulty with retaining facts, memory, focus, and so on. So we need to look at the person as a whole, really. We can't just say, right, this is the symptom here, have this one hormone. We need to look at it as a bit of a puzzle, really, and we need to get all the parts fixed.
Amazing. Thank you so much.
You're welcome.
For being on this podcast, and also thank you so much for helping me. I feel totally different, and that meeting with you was kind of like the start of what inspired me starting this podcast, because I was like, right, everyone needs to know about this right now.
Thank you, it's my pleasure.
Hello again. I hope you enjoyed that conversation. Isn't Dr. Myra amazing? You can see why I felt so safe in her hands. She has taught me so much, and I'm sure she taught you a few things as well. If you have any questions, please leave them below or send us a message on Instagram. I would also really love to hear any suggestions to topics that you want me to cover. Lastly, it would mean a lot to me if you follow the podcast and leave us a 5-star review. Thank you so much for listening to Am I Crazy? Or see you next time.